Welcome to LiveWell Talk on Mailbag. I'm Dr. Dustin Arnold, Chief Medical Officer at UnityPoint Health, St. Luke's Hospital. The Mailbag is a segment of the podcast where we take time to answer questions that are submitted from listeners. And with Heart Month on presenting itself, as well as Valentine's Day, it is appropriate that we are discussing heart issues or cardiac issues on today's Mailbag. So, wishing everybody a happy Valentine's Day. Our first question is from Carrie. What is the link between cholesterol and heart disease? How can I lower my cholesterol levels to lower my heart disease risk? Well, what happens is, let's think about heart disease. So you have a pipe, which is a blood vessel, a cardiac blood vessel, and cholesterol plaque builds up. And if you have high cholesterol, the higher the cholesterol, it will build up. And then the shear forces of high blood pressure, the effects of nicotine on that plaque cause that plaque to rupture. And just like when you cut yourself shaving, it starts to form a blood clot when it exposes that endothelium, the lining of the blood vessel. And then that's when a heart attack occurs. So for patients that want to prevent that, we want low blood pressure, don't smoke, cholesterol lowering agent, which is the simvastatins, the HMG-CoA reductase inhibitors, or the quote statins, end quote, which have not only the effect of lowering the cholesterol, but they also make the plaque smooth and prevent it from rupturing. And then also we take an aspirin or some sort of antiplatelet to make the blood less sticky so that clot doesn't form when that plaque ruptures. So the way to lower your cholesterol, one is a low cholesterol diet. Here in Cedar Rapids, we have General Mills. We make Honey Nut Cheerios, but regular Cheerios are a great source of low cholesterol diet. And likewise, but for the most part, patients, to get it low enough, they have to take a medication. You want the bad cholesterol, you hear that term, you want that below 100. Now, you can raise your good cholesterol by exercise, and certainly not smoking would also be a benefit to having a lower risk of heart disease. Great question. Our next question is from Joe. I had some symptoms like fatigue and chest pain that go away with rest, but my stress test came back normal. Luckily, my cardiologist proceeded a heart cath and found blockage in my arteries. Is this a common occurrence for stress tests to come back normal, even though there is an issue? Can there also be a false positive? Yes and yes. That can happen. And particularly, I don't know what kind of heart test you had, whether it's a stress test or nuclear medicine test. And what can happen there is you take a picture of the heart at baseline, and then you take a picture of the heart with exercise. And if there is balanced coronary artery disease, right? So there's blockages in multiple vessels, then the rest picture and the stress picture may have a similar appearance because it's symmetrical. And that does happen. And that's why cardiologists, one, they take your whole story in account and they really listen to the symptoms. If you remember, we had Dr. Longager on, who his podcast aired of recent during Heart Month here, that the history, taking the history from the patient describing what is happening was more important to him than testing. You know, the testing confirms your suspicion. So my feeling is your cardiologist was on top of it, had a suspicion, and kept pursuing until he got that answer. There are times that you get false positives. You can have spasm of the coronary blood vessels that may give a false positive. So you see what appears to be an asymmetry or a blockage, and indeed it's not. It doesn't happen. I think we're getting better at doing stress tests, maybe. It doesn't seem like it happens as much as I've seen it happen in the past. The good thing is, Joe, that you got the care that you needed. Our next question is from Abby. My mother suffers from high blood pressure and other heart issues. Her cardiologist has warned her about getting the virus and has instructed her to take precaution when going out and about. In your opinion, what is the impact of COVID-19 on heart disease, high blood pressure, and other heart issues? Will these patients ever lead a normal life? Well, there was a study done with, just published, I just read it this week, and I have it right in front of me, that they found that during the short-term acute illness of COVID, that there's inflammation in the body that can cause heart-related blood clots and heart attacks, et cetera, as well as strokes, and we've known that. But they also found that beyond the acute phase, there was 12 months out there is still a burden of cardiovascular disease that might translate into a larger number potentially having heart issues, even though they've had COVID. So your cardiologist is right. You want to minimize your exposure to COVID because it could accelerate or cause cardiac problems we've gone out a year. Now, this study was limited on some limitations. It was the VA, Veterans Administration, and it was computer report run. That's for the most part, that's white males are a majority of the military Veterans Association. So there may be some limitations there as far as male, female, and ethnic characteristics of that data. But it does stress that COVID may have an impact on patients' health beyond the acute illness. I think these patients can certainly live a normal life as long as they continue to modify those risk factors for heart disease. And the most strong one is that you reduce smoking as well as control obesity and high blood pressure. Remember, we talked about like family history of heart disease is like an unloaded revolver. Not necessarily dangerous, but you start to make it really dangerous when you start adding bullets to the chamber of diabetes, hypertension, smoking, etc. So minimize those risk factors and you'll be good to go. Our last question is from Danielle. What determines when a person requires artery cleaning measures, angioplasty, shockwave therapy, things we've talked about, versus open heart surgery? I think the best way to describe that, and this has changed a little bit over the years, but so after they would put a stent in, there's a possibility that it can close off. So if you're putting a stent in and it's in an area there's no collateral circulation, those are the patients that go for bypass surgery. And historically, that has been patients that have the main left coronary artery coming off the aorta if that occlusion of that is prior to when it starts to bifurcate into the other coronary blood vessels, that would be something you'd have to bypass. Sometimes patients have such small disease that stenting is preferable, and also patients may be at high risk to have a stent placed for whatever reason, and the open heart surgery is the better alternative. But the main reason is that it's the proximity to the coronary vessel is so close that you can't, if you stent that, there's a risk of occluding prior to that where it splits off and feeds the heart. Also, if you have significant blockages both on the left and the right, you can't stent both those at the same time because there's a risk of one or both of them occluding, right? Rare, but it could happen. And so sometimes those are patients they choose to do bypass surgery on. Over the years, we've done less bypass surgery, but we're still doing them. Dr. Whitey had 2 cases today. I saw that on the schedule. And so they do occur in the appropriate patients. That's all for the mailbag today. If you'd like to submit a question in the mailbag, go to unitypoint.org/mailbag, common spelling of mailbag, MAILBAG. I'll answer questions about COVID-19, latest technologies, previous podcasts, answer questions that maybe have been in the recent news. Happy to answer anything that is submitted. But note, mailbag is not an alternative to personal health care. Those issues should be addressed with your primary care clinician. And if in an emergency, go to the nearest emergency room. If the emergency room is not near you, then 911. Once again, you can submit your questions to me at unitypoint.org/mailbag. That's unitypoint.org/mailbag, MAILBAG. I look forward to hearing from you, our amazing listeners. Thank you for listening to LiveWell Talk On. If you enjoyed this episode, don't forget to subscribe. And if you want to spread the word, please give us a 5-star review and tell your family, friends, neighbors, strangers about our podcast. We're available on Apple Podcasts, Spotify, Pandora, or wherever you get your podcast. Until next time, be well.